Uramaxin Lotion contains two types of ingredients, emollient and keratolytic, that work together to treat or prevent dry, rough, scaly, itchy skin caused by conditions such as eczema, keratosis, and xerosis. Emollients soften and moisturize the skin, reducing itching and flaking by forming an oily layer on the top of the skin that traps water in the skin. Common emollients include petrolatum, lanolin, mineral oil, and dimethicone. Keratolytics like lactic acid, salicylic acid, and urea increase moisture in the skin by softening and dissolving the substance holding the top layer of skin cells together, helping dead skin cells fall off and keeping more water in the skin. Urea is used in higher strengths to treat corns, callouses, some nail problems, and to remove dead tissue in some wounds to help wound healing. Make sure to use Uramaxin Lotion as directed by your doctor or pharmacist. Some products may need to be shaken before use, so be sure to check the label. Apply the lotion to the affected areas of the skin 1 to 3 times a day, or as directed by your doctor. Rub it in well until it's absorbed. How often you apply the lotion will depend on the product and your skin condition. Only apply the lotion to the skin or nails, and be sure to avoid sensitive areas like your eyes, lips, inside your mouth or nose, and the vaginal or groin area, unless your doctor tells you otherwise. It's important to use the medication regularly to get the most benefit from it. For best results, apply the lotion after bathing, showering, or shampooing while the skin is still damp. If you have very dry skin, your doctor may instruct you to soak the area before using the lotion. If your condition lasts or gets worse, be sure to inform your doctor. When using Uramaxin Lotion, you may experience burning, itching, stinging, redness, or irritation. If these effects persist or worsen, it's important to notify your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the potential risks of side effects. Most people who use Uramaxin Lotion do not experience serious side effects. However, it's important to contact your doctor immediately if you notice any unusual changes in your skin, such as blistering, peeling, or signs of infection. Although rare, a severe allergic reaction to this medication can occur. Seek medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Be aware that this is not a complete list of possible side effects. If you notice any other effects, it's important to contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects and to report any side effects to the appropriate regulatory authority in your country. Before using Uramaxin Lotion, it's important to talk to your doctor or pharmacist if you have any allergies to the ingredients in the product. This includes urea and lactic acid. The lotion may also contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist. If you have a history of skin cuts, infections, or sores, be sure to inform your doctor or pharmacist before using this medication. It's important to note that using this lotion may make your skin more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when in the sun. They may suggest limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, notify your doctor right away. Some products may cause staining or discoloration of clothing. For more information on this, consult your doctor or pharmacist. If you are pregnant, Uramaxin Lotion should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor before using it. It's unclear whether this product passes into breast milk, so if you are applying this lotion to the breast area, consult your doctor before breastfeeding. When using Uramaxin Lotion, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Uramaxin Lotion. If someone accidentally swallows Uramaxin Lotion, it can be harmful. If the person has overdosed and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center for assistance. It's important not to share Uramaxin lotion with others. To help prevent dry skin, you can use lukewarm water when bathing, take baths or showers less often, such as every 1 to 2 days, keep baths or showers short, and use a humidifier when the air is very dry. These are simple ways to keep your skin healthy and moisturized. If you happen to forget a dose of Uramaxin lotion, just apply it as soon as you remember. If it's almost time for your next dose, then it's okay to skip the missed one. Just continue with your regular schedule for the next application. Avoid using extra lotion to make up for the missed dose. Remember to always use the lotion as directed by your healthcare provider. When using Uramaxin lotion, it's important to store it at room temperature and avoid freezing. Some forms of the product, like foams, may be flammable, so be sure not to store or use them near an open flame. Keep all medications, including Uramaxin lotion, away from children and pets. When you no longer need the product or it has expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.